Alexia, for example, says, how do you know you've corrected the coccyx? Does the pain go away straight away?
I ask the patient to sit on the table and to rock backwards and forwards, okay? And they say, I can't do that, it will hurt. Okay, fine. After I've done the correction, sit on the edge of my table, give me your hands, rock and roll. And you get this, oh, look, I can sit on both sides. Now that's important. And if we actually look at the slide that talks about the results, 54% are completely symptom-free after just one treatment. That in itself.
And only 5% need more than two, which is really, really good.
And only 2% are made worse.
Right.
You know, this is an indication, if we add these up, you know, you're getting over 80%.
Yeah.
And if it's a hypermobile one, you'll know by the second treatment, send them off for a steroid injection.
So what's happened when somebody gets worse then? What mechanism might provoke a exacerbation?
It might be psychological. It might be because they are hypersensitive. Mm-hmm. It might be because the diagnosis is wrong.
Right.
You know, nobody gets it right 100%. But that figure of 2%, comparing it to the 80%, it is to me an indication that says, given the protocols, using a Coccyx provocation test and getting a response that says that's painful with the provocation, there's the response.
There's an interesting comparison there to be made as well, though. We've now got 84% who got better after one or two treatments, but we've got a total of 46% who had good relief, but the pain came back or no difference was made. So the bigger number is how many got relief, but the pain came back.
Well, that's not uncommon. No, that's not uncommon. And I think you have to explain to the patient. And I actually show my patient that slide.
Yeah.
And I say, you know, if you're in this group, okay, or this group, maybe what we can do is to release the symptoms, especially if it's spasm around the paracoccygeal muscles. But if it's hypermobile or if there's been a tear, you know, that will come back. So what I would suggest is a corticosteroid injection. Oh no, I don't want any injections. I had injections before I came to you and they didn't work. Okay, fair enough. Then all I can say is that let's see how far we can get into here. But certainly if you're one of the 2%, we only do one treatment and that's it.
Right, okay. But if you're one of the 36 who get good relief and the pain has come back, would you then say, well, let's do some more and see if we can...
I would say, okay, let's do the technique. One, maybe two treatments. How do you feel? Much more comfortable. 6 months later, oh, hi, it's come back again. Or, oh, I was in the gymkhana and I was riding badly, or I had a fall, or whatever. Okay, fine, come back in again, repeat your protocol, repeat your differential diagnosis, and hopefully try and get into this 80%.